Okay, as it is 8 o'clock, we will go ahead and get started. Welcome everybody to Future Peds Res, our last of our summer webinar series. It is crazy that this team has put together 16 total webinars for you all for this season. And we have one left to go, but that doesn't happen until October. So we're really rounding out our summer portion of what we do. And we are so excited that you are with us tonight to learn about some of the larger programs in the Northeast region. So we will go ahead and get this party started for you tonight. So I just wanted to introduce myself. My name is Caroline Maltese. My pronouns are she, her. I'm a fourth-year student at Penn State College of Medicine, and I proudly serve as one of the co-directors for the Future Peds Res organization for this year. And I work alongside Stephanie Maeda. Her pronouns are she, her. She's a fourth-year student at Western University of Health Sciences, and she's the other co-director that works with me. Unfortunately, she was not able to be here tonight, but she works diligently behind the scenes to make sure that these webinars go off without a hitch. So this would not be possible without her help and support as well. I would also like to acknowledge our APPD faculty advisor. So Dr. Michael Dell is the Vice Chair of Education at Case Western Reserve University School of Medicine, as well as Colleen Hughes, who is the Associate Executive Director for APPD. I would also like to acknowledge our concept faculty advisor, Dr. Rachel Thompson. She is the Assistant Professor of Pediatrics and Director of Pediatric Undergraduate Medical Education at the Boston University Chobanian and Avedisian School of Medicine. These individuals have made tonight possible, and we are extremely grateful for all of their support and guidance that they have provided for us every step of the way. These webinars would surely not go off without a hitch if they were not involved. So we do thank them so much. All right, it is now my pleasure to introduce to you all our assistant directors of webinars for the Northeast region.
Hi, everyone. I'm Fiona Whitaker. Sorry, my camera's off. The Wi-Fi's working better with it off. So my pronouns are she, her. I'm a fourth-year medical student at East Tennessee State University.
Hello, everyone. My name is Lavanya. My pronouns are she, her, and I'm an international medical graduate from India.
And we would also like to introduce our FPR Webinar Associate Director working hard behind the scenes tonight, Sheena.
Good evening, everyone. My name is Sheena Bedi. I am an international medical graduate from D.Y. Patil Medical College, India, and I serve as the Associate Director of Webinars for FPR this season.
All right, let's delve into our goals for the night.
Welcome, everyone joining us tonight. We are so excited to have everyone at the Northeast Region Large Programs webinar, and are grateful to everyone who has taken out the time to be with us tonight. Our series goal for the regional webinars are providing pediatric residency applicants with foundational knowledge surrounding the virtual interview season, well-rounded insight into the benefits of programs by region, devoted time for live Q&A if there is time at the end. Before we move on, we will have the APPD representative of the Northeast region states, Dr. Stephen Barone, who will give us a quick overview of some of the states included in the Northeast region from the APPD leadership in that region. Dr. Barone, would you mind starting us off?
Sure. Can you put my slides in presenter mode, please? Thank you. So as mentioned, my name is Steve Barone. I'm the Vice Chair Education and Pediatric Program Director at Cohen Childrens Medical Center. I've been a program director for about 20 years, and I think this is my fourth or fifth year being the New York, New Jersey Regional Chair of APPD, and I've hosted these webinars each of those years. Next slide. So this is data from FRIDA that talks about the largest residency programs in the US. If you get a quick look, and if you go to the next slide, you can see a number of them are in the Northeast region. So certainly we have our fair share of large residency programs. Next slide. It's somewhat arbitrary to break programs into largest and larger. So I added a couple of the other larger programs kind of in the Northeast. So if you're looking for larger programs in the Northeast, in the Philly region, in addition to CHOP, which I showed you, there's St. Chris, and not too far is the Moores. That's in Delaware. I think you had it in the southern region, but a lot of people in the Northeast apply there, and Hopkins in Baltimore. In the New York region, in addition to Cohen's being a larger program, some of these other programs are on the webinar tonight and some are not, but I think they're equally kind of larger. That's Columbia, Cornell, Downstate, NYU, and Westchester. And you go a little north of us, you have University of Connecticut and Yale. And I already showed you a little north in Massachusetts, you got Boston Children's. And if you go a little bit out west of Philadelphia, you got UPMC. But those I showed you earlier. Next slide. So a lot of people who apply to Northeast apply what I call the Amtrak corridor. That's they go as far south as Washington and then as far north as Boston. And if you look again in the DC area, you got Children's National, you go a little north, you got Hopkins, you got a little north, you got the Moores in Delaware, in Philly, you got CHOP and St. Chris. There aren't really any large programs in New Jersey, then New York, you got Cornell, Columbia, Cohen's, myself, NYU, Downstate, we mentioned. You flip on over to Connecticut, you got Yale and UConn, and you right up to Boston, you have Boston Children's. Now you have to get to Pittsburgh, you got to take a car. There's no Amtrak way to Pittsburgh. So that's kind of the Northeast. So when people apply to Northeast programs, that's kind of what they generally look at, those type of programs. Next slide. So why large programs? Because larger programs are like Disney World, right? It's nice to go to your local amusement park. You don't have a little roller coaster. You don't have a little Frogger jump. But you go to Disney World, you got everything, right? You never go to Disney World and say, oops, I'm disappointed I went to Disney World and didn't have anything. And that's what larger programs are. You won't go there and ever be disappointed because you won't find something. Next slide. So in general, large programs have a larger or greater clinical experience, a greater variety of clinical experiences just by their population, larger faculty, which is a larger percentage of people to find mentors, research opportunities, more mentors, more research opportunities. They are focused more on children's services. Medium and small size programs tend to be part of adult hospitals. So a lot of these hospitals are freestanding. I think there's increased camaraderie among residents that may be counterintuitive, but why I say that is because your personal time is protected. If you have 10 residents in your class and 2 women get pregnant and 1 guy gets sick, now you got 7 covering 10. My program, you have 35 residents, you lose 3, you hardly miss a blip because everyone can do a little bit. And increased exposure to fellowship opportunities. So those are just some of the quick things I thought about, that some of the benefits of larger programs. Next slide. So what are the concerns? Is it too large, right? Will I get lost? And I think that's something you have to think about on a personal nature. If you're kind of an understated individual, someone that doesn't put themselves out there, just think about it. Will I be okay in a really large program where you have to kind of be more outgoing to be noticed and to get opportunities? So that's just something you got to think about. Next slide. But then I say a lot of large programs are just the size of a kindergarten class, right? I got 31, 32 residents. That's a kindergarten class, right? We all knew everyone on a kindergarten class. So it's not too bad. Even you go to the largest program like CHOP, so it's 2 kindergarten classes. You probably knew most of the kids in your kindergarten in your school. So again, don't be so scared that the larger programs are too big. Next slide. And we are in some of the greatest cities in the world, right? I just have pictures here of Philly, Boston, New York, and Connecticut's not so much of the larger big cities, but a lot of nice small cities like New London, New Haven, etc., Stanford. So, and then the cities have a lot of things for you to do. So that's a quick whirlwind overview of Northeast Lodge programs. And I'll turn it back over to your host.
Thank you, Dr. Barone, for such a wonderful presentation of what the Northeast region has to offer. So I would now like to invite our program representatives to give a short presentation of their programs for 5 minutes for the first part of the evening, and then we'll take questions after all the presentations if we have time at the end. Attendees, you can leave your questions in the chat as we go, and we encourage programs to make use of the chat to answer any questions in case we run out of time before the end. To ensure all programs are adequately represented, each presentation is limited to 5 minutes. There will be a timer in the upper right corner of the Zoom session and on Sheena's screen, like you see right there. So our first program of the evening is Boston Combined Residency Program. I'd like to invite your representative to unmute and tell us about your program.
So, hi, I'm Ted Sektish. I am the program director at Boston Children's, and we're a combined program. We have both Boston Children's and Boston Medical Center as the primary sites for where you will train. I think we're unique in that we have a lot of people who end up going into subspecialties and fellowship programs afterwards. So I think that that is one of the things you should consider about this. Plus, being in Boston, it's a wonderful place to train. And I'll turn it over to Jill Casper to talk about the LEAD program in particular.
Hi guys, thanks for having us. I'm Jill Casper. I'm a pediatrician here at Boston Medical Center, and I'm selection chair for the Leadership in Equity and Advocacy track of the BCRP. The lead residents, so there's 2 tracks. There are the residents who are based at Boston Children's and at Boston Medical Center, but you're both going to spend time at the 2 hospitals. Boston Medical Center is the oldest, formerly Boston City Hospital. We're the largest or the oldest hospital, city hospital in the country, and we're also the largest safety net hospital in New England. We're the home of Reach Out and Read, so a 35-year-old nationwide program where kids get books at every CPE. We have a robust multidisciplinary ambulatory clinic where our residents and primary care providers are seeing patients in the same setting as all of our specialists. And really a lot of innovation in our care delivery models with the teen program. We have a dedicated advocacy curriculum. So we're really giving residents the tools that they need to address social determinants of health from the patient to the policy level. And I'm going to turn this over to some of our incoming chiefs who can talk a little bit more.
Hey everyone, my name is Win. I am one of the, I'm just one of the many actually rising chiefs on the Zoom. And I'm also one of the lead residents. Feel free to shoot me any messages if you guys have any questions or so. But I'm part of the lead track, and we get a really great opportunity to do some great work in like equity, leadership, and like a lot of advocacy work. One of the examples we have for one of our unique opportunities is we have like different areas that we have protected to do advocacy work. And one of the things that we've done that's been really cool is to lobby at the State House for really great bills that we are very passionate about. I think it's like a really great opportunity to train at the BCRP because you get both the environment of Boston Children's and Boston Medical Center, who you get such a wide range of patients and experiences as well. I'm not sure if any of my other co-chief or any of my co-residents want to add on to their experience.
I can say hi, I'm Davika. I'm also one of the rising chiefs. I am part of the categorical program. I echo everything that Wynn said. And if you are interested at all in getting involved in research and trying to find out how to do that in our program, feel free to send me a message. Or if you want to know about wellness and some of the social things that we do on our house staff association, I'm happy to chat.
I'm Katie. I'm also one of the Rising Chiefs with Wynn and Davika. I just wanted to elaborate very briefly on something Wynn said just about our advocacy curriculum and just the fact that we're in the state capitol, and we've done a lot of work really trying to get residents to the capitol in various parts of the year to advocate for like local policy. We were just there to address housing related issue at the state level. We were there earlier in the year to talk about Cover All Kids, which was a bill that was focused on expanding health insurance to kids who have immigrated here and really need like more adequate healthcare coverage. And so we're really there like almost every couple months advocating with legislators, which is a really awesome perk of being at the state capitol.
Thank you so much for letting us present our program to all of you.
Thank you all so much for sharing. Our next program is Cohen Childrens Medical Center, and we're going to get the slide pulled up real quick. And then I'd like to invite your program representative to unmute and tell us a little bit about your program.
Hi, it's me again, Steve Barone. First, I want to take the first minute. I left Montefiore off my slide, so do not want to forget our colleagues in the Bronx as a larger program in New York. I apologize, Montefiore. I noticed when I clicked on the slide, you were not there. Okay, so Cohen Childrens Medical Center is located on the Queens Nassau border. If you understand New York City, it's broken up into a number of different counties, and Queens and Brooklyn, although they're part of New York City, really are on Long Island proper, and then the main counties of Long Island are Nassau and Suffolk as you go east. So we're on the Queens Nassau border. So we're kind of like both an urban and suburban program. I can say that most of our population comes from Queens. And if you look at census data based on languages spoken, Queens County is the most diverse population in the United States, probably the most diverse in the world. And when you ask our residents, name top 3 things they love about Cohen's, diversity of patients is always in that top 3. It is the largest children's hospital in New York State, has the largest faculty in New York State. Some of our more specialized programs are a level 1 pediatric trauma center, the first one in downstate New York region. We have Magnet Award-winning nurses. This is a big deal. There's only about 3 dozen children's hospitals in the world that have Magnet Award-winning nurses, which is a testament to not only their clinical skills, but their research skills and a collaboration. We have 17 subspecialty fellowships. In our mission, you can see there, you guys must have pulled off the website, is to be a national leader in pediatric education. So our curriculum, we have block schedule like a lot. We tend to not have an X+Y schedule because what I've run for a number of years is your second and third year, you have a half day devoted to whatever additional ambulatory experience you want. So a lot of us residents go into fellowships, will do 2 years of nephrology clinic or cardiology clinic or ID. You're interested in primary care, you can do additional primary care training. We have multiple, I don't like the word pathways or tracks. It seems like you get locked in, so I like to call them adventures. These include global health, critical care, hospitalist medicine. We have a new health equity adventure. We have a community medicine adventure called Enhanced. So beginning your second year, you can start really individualizing your curriculum. We have one of the largest simulation centers in the United States. When it was built, it was the largest. I don't know if it is anymore. We have a large focus curriculum, point-of-care ultrasound, because I think that's the future. And we have a lot of opportunity for research. Last year, 30 of our residents presented at national meetings. You look at our diversity initiatives, as most programs, if you're a URM in medicine, you can do an elective. We have a mentor program. This is when residents, faculty, and fellows from underrepresented groups get together once a month. I pay for them to go out to dinner, and they get provided mentorship in their career choice and research. And the real goal is to keep underrepresented medicine individuals in academic medicine. Like I said, we developed a shared health equity pathway, which includes a course at Hofstra University, and we have opportunities to participate in pipeline programs. And just a week ago, I was at the graduation for 7 college students who partnered with 7 of our residents for 6 weeks to have mentorship and develop a research project and understand what applying to medical school is. I'd like to say we have a learner-centered environment. We have a large resident lounge. I was able to secure a catered lunch daily this year. Towards the end of last year, nothing speaks to our residents' happiness than having nice catered lunch every day. We are kind of suburban, so parking is not a problem. We have plenty of happy hours, retreats. In fact, the residents had a large barbecue planned today. We postponed it to tomorrow because of the weather. Like I said, we're located on Long Island, Nassau, Queens. This past weekend, I went to the beach. This past weekend, I went to a Met game. My kids were your age. One went to Brooklyn for dinner, one out to Montauk, end of the island to spend the beach. So plenty of opportunities for the city, hiking, biking opportunities. And I'll leave it at that because time's up.
Thank you, Dr. Barone, for sharing about your program. Our next program of the evening is Montefiore Medical Center. I would like to invite your representative to share about your program.
All right. Thank you so much, everybody. Good evening. And thank you, Dr. Barone, for thinking of us. We are from the Boogie Down Bronx. For those of you who don't know us, that is the home of a lot of different artists. And despite our New Yorkers who think that they need to get a passport just to come down to New Borough here, we have a lot of different things that we're proud to boast about. But in the short time, I just want to sort of highlight a couple of different things. While we consider ourselves to be a medium to large size program with 30 residents per year, we certainly see a ton of patients. We are actually the only pediatric hospital in the Bronx, which really caters to about 500,000, 500,000 children in the area. And so we are a very, very busy center. We see a diversity of cases here. That's probably the most important thing that residents currently here and fellows also talk about. I'm actually a graduate of Boston Childrens myself. And so I certainly know what that feels like in terms of the scale of a very large program. And I can tell you that is very similar in terms of what your experience you're going to receive here at Montefiore. I will say that there's a couple of different things. We do have a couple of different tracks. We have the social peds track, and very similar to some of the other programs that you'll probably hear as well too. And I'm going to leave that for our chief to talk a little bit more about the various different tracks if there's any more specific questions when we get to that point. And we also have a research track as well and a categorical track. And then as far as the curriculum, we do have currently the block curriculum, but we are going to be moving to X+Y by the time most of you will be applying, and if not, enrolling into the 2025 to 2026 academic year. And a whole host of other different things that are really super important to us, but we are very, very proud of our diversity initiatives. We take that extremely proud, where we consider ourselves an academic center with a community feel. So I'm going to just pop it over to, I have one of our APDs, Danielle Fernandez. Dr. Fernandez is here. She may want to add additional things. And then Lon also, who is one of our stellar chiefs.
Yeah, I think the only other thing I wanted to add is, we're really excited to be here, and we're really excited about some of the new program changes and exciting updates that we have in the next year or so. So they're highlighted here, but we are moving towards, with the new ACGME guidelines, we're moving towards X+Y in the next, hopefully in the next year or so. We also have really wonderful electives as part of our program and a great academic half-day model that our residents have really loved in the last few years. I'm going to turn it over to Lon, one of our chief residents, to talk more about some of our diversity initiatives, resident wellness.
Thank you.
Feel free to also pop any questions in the chat for us.
Hi, thank you, Dr. Fernandez, and thank you, Dr. IJ. My name is Lai. I'm one of the current chief resident at CHAM. So one of the things I'm so loved about CHAM is this DEI initiative, specifically LEADER program, stands for Leadership, Engagement, Advocacy, and Diversity in Education Residency. It's a very unique program that's completely residents driven and supported by the faculties, has 4 different subcommittees, including education, community, mentorship, and recruitment. Currently, we are also in development of a 5th subcommittee with the hope to supporting international medical graduates with their transition and success in their medical career in the US. Some exciting upcoming events of LEADER is we do have a virtual open house sponsored by LEADER. We welcome all the prospective applicants to join us on August 22nd. I will drop the information in the chat. And then we also have very strong collaboration with our local community. For example, we're organizing a clinical skill sessions with a pre-med student from Bronx on this Thursday. And then we also invited ACS and Bronx Defenders to help us with our academic half day this week. That's just some highlights of the upcoming events hosted by LEADER. Thank you, everyone. And then I will leave my email address in the chat as well if you have further questions.
Thank you guys so much.
Hey, thank you all so much for sharing about your program. Our next program is Cornell. If your representative would unmute and tell us a little bit about your program.
Hi, good evening, everybody. So I'm Melanie Wilson-Taylor. I'm the program director here at Cornell. Lovely to see my fellow New Yorkers on the call. Hi, everybody. So, as far as our program is concerned, New York Presbyterian Hospital actually has 3 residency programs. Cornell, Columbia, and Brooklyn Methodist. And so our program specifically is on the Upper East Side of Manhattan. And unlike where we are located, we actually serve a diverse population, the local area, as well as the 5 boroughs, New York, New Jersey, Connecticut, and as well as Long Island. Similar to what Dr. Barone talked about, we do have a community engagement at New York Hospital Queens in Flushing, which is definitely one of the highlights for our residents, both being an academic center at the main campus, and then also being able to provide care for patients in that neighborhood as well. We do have an extensive relationship with 2 other subspecialty hospitals, Memorial Sloan Kettering for oncology care and the Hospital for Special Surgery. And so definitely helps to round out the education for our residents. We do have, so we also don't have specific tracks specifically. We do have positions for categorical, pediatric neurology, as well as physician scientist training programs. But our residents participate in an individualized curriculum and working. So even 2 people who are going into primary care can have very different educational opportunities based on their areas of interest. This past year, we've introduced a health equity concentration. So again, not a specific track, but for those interns who are very interested in this going forward. We do have a scholarly activity that all of our residents participate in, and it varies. There's no specific requirements except that it be scholarly. And so our residents take advantage of that opportunity. So doing basic science, clinical translational research, but many of our residents actually do projects in quality improvement as well as community and advocacy. And with this introduction of health equity and opportunity to conduct a scholarly activity in that area as well. I think one of certainly the things that are exciting to me in my role as program director is really to be able to support the varying interests of our trainees. And so our residents have about 1/3 going into primary care and 2/3 into subspecialties upon graduation. So despite being a relatively large academic center, we do have a number of residents who are very much interested in primary care. I think that has been well supported with our X+Y schedule and our academic half day, which focuses on primary care topics, development, advocacy, adolescent, mental health, and as well as primary care. And I think this lends itself to trainees being well supported in both areas and feeling confident upon graduation. I think one of the advantages, so we are a children's hospital within a larger institution. And so as part of that, and as opposed to a standalone hospital, we do receive a lot of support and interactions with the rest of the hospital, mostly on quality improvement initiatives, patient safety, and certainly have been able to take advantage of that component as well. Our supportive GME office. So we're probably one of the largest in the country, both between all the different campuses and fellowship programs. And as a result, there are a number of financial incentives, access to housing that is below market rate for the Upper East Side, transportation, food, and educational stipends. Steve mentioned about being fed. So we try to feed our residents. I think it's really important, but to make sure that they are well supported outside of just the academic institution. I think one of the other components that's really near and dear for us certainly is our diversity initiatives. Again, one of the things that's really important to our department, but also well supported by the larger hospital system and the medical college. So I think having everybody aligned with the initiatives is really important for us to be able to maintain a culture of diversity, as well as a number of educational opportunities, especially for our trainees who may not have had that coming to our program. We do have a number of recruitment initiatives supported by the institution, virtual events, including Make Your Match, which is prior to interview season, our diversity mixers, and welcome back events. And I think one of the other components, certainly that's really important for us, is our robust mentoring program, being able to support our trainees who may not know what they want to go into, and certainly being able to help them expand their ideas and solidify their professional development with program advisors, our near peer mentoring program. And I think my time is up. Thank you all for your time.
Thank you so much for sharing about your program. Now, our next program of the evening is University of Connecticut. I would like to invite your representative to share about your program. Okay, it looks like we don't have any representative from University of Connecticut. We will circle back to them.
I'm going to text him because I know him. We went to residency together. I'm going to text him.
Yes, I know Stu Mackey. He is a very responsible individual.
Yeah, something is not right. Yes. Uh-huh.
All right. Should I start? I guess I'll start.
Yeah.
Hi, folks. Oh, no, we're back on UConn now.
Let me announce again. So our next program of the evening is Westchester Medical Center. Go ahead, Dr. Kaplan.
Okay. Hi, folks. My name is Matt Kapklein. I am the program director at Montefiore Children's Hospital, Westchester Medical Center. The main thing that distinguishes my program from all the other programs that you are going to hear about this evening is that we are not located in a major city. We are located near a major city. So Westchester is the county that's just north of New York City. And our location is probably the reason why most people select our program and most people don't select our program. We have easy access to New York City. About now someone's calling me. About a third of our residents live in New York City and commute to Westchester every day, which is a pretty easy commute because all the traffic is going in the opposite direction. But the diversity that Dr. Barone talked about at Cohen Childrens is an international diversity. People in Queens come from all over the world. The diversity that we offer is more of a sociocultural diversity in that we get patients from urban, suburban, rural environments. We serve the entire Hudson Valley, which is the region surrounding the Hudson River that goes north of New York City all the way to Albany. That region has 2.3 million people in it. And we are the children's referral center for that entire region. We're a full service children's hospital. We offer the full range of pediatric services. We do ECMO, we do cardiac surgery, we do brain surgery, we do organ transplants, we do bone marrow stem cell transplants. We do not do small bowel transplants. So if you are gung-ho to do small bowel transplants as part of your residency training, we will disappoint you. We have about 20 plus residents per class, which makes us a little smaller than some of the other programs that you've heard from this evening. When you ask our residents what they like best about our program, the answer they typically give is their fellow residents, which I take as a very good sign. That makes me think that we're doing something right in creating a cohesive environment that people bond with each other in. I am a diagnosis junkie, and I have to say I've been at Westchester Medical Center now for more than 20 years, and it never gets boring. We see really amazing stuff, mainly because I'm trying to put this. I want to make it sound like don't want to make it sound like I'm putting other programs down while promoting my own program. But we're not competing as closely with other programs as some of the programs in New York City are. The plus side of that is that really any child in the entire Hudson Valley who needs subspecialty care will come to us. The downside of that is that we don't have as good public transportation as the programs in New York City do. So you will need a car if you come to our program. And if you go to IJ's program or Steve Barone's program or Melanie's program, you do not need a car. Because we are in the suburbs and our patients are so spread out, we are largely referral based. Our patients come to us either from local referring hospitals or referred by a local pediatrician. And that means that we do not have a large centralized clinic. What we do have is a variety of continuity clinic sites all over the surrounding area, ranging from federally qualified community health centers to private practices. So our residents get a very diverse continuity experience, different from one another. We do not have tracks. In fact, I would say that one of the hallmarks of our program is that we encourage residents to design their own educational experiences. Our individual electives are wide open, and as a result, our residents do really interesting, creative things. They go to other countries, they go to other institutions in the area, they design their own electives. But I would say the thing that defines our program is really self-direction and self-motivation. We really look for people who want to push themselves and who want to think about their own education. Like many of the other programs you've been hearing about, we have our share of diversity initiatives. We have a resident-run diversity task force. We have a formal curriculum in diversity, equity, and inclusion, as well as social determinants of health and anti-racism. We have required rotations in community peace and advocacy, and that's my time. Peace out.
Matt, you're so funny.
Thank you, Dr. Gapkley. Now our next program of the evening is St. Christopher's. I would like to invite your representative to share about your program.
Hi, good evening. Can you hear me okay? All right. My name is Keandra Lewis. I'm the Associate Program Director for our program. We are I think, sizable kindergarten class. We have 24 per year. We like to say it's a community feel style hospital or a standalone children's hospital. But the thing that brings people to our institution and keeps people there is really the people. I kind of pull everyone every year as we're getting ready for recruitment, and that's always a constant answer. A lot of the faculty have trained there, myself included, and have stayed there. And I think that brings us richness of people that really are passionate about not only the medicine there, but the community. And so our two strengths are community advocacy and social determinants of health work. A lot of programs that we're fostering within our curriculum happen outside of the hospital. We take a lot of input from the community and really get their understanding as to how we can create programs to really sustain efforts. Just this summer, we've had a couple. We had our back to school carnival, which is a large community event that helps our children get ready for school, prepares them with the essentials that they need. A lot of our patients come from marginalized and underserved areas. And so it's really important for us to give them the equipment that they need to foster really important relationships in the community and in their education. We also have school lunches that happen throughout the year. We know that a lot of our children are actually going to school with poverty and are not able to eat. So our hospital offers nutritious supplements to their day-to-day kind of going abouts too. So we're really thinking about creative ways to kind of foster that collaboration with the hospital and the surrounding community. We have a lot of different tasks that are not just for the children too. We have an opioid task force, mental health screening initiatives that we partner with some of our adult specialists that work at other institutions, but come to our hospital to kind of care for the whole family as a whole. Some of the other aspects of our curriculum in our program really focus on education. We also say we're the house that Nelson built. And so that's Waldo Nelson. He created a lot of scholarly activities for our hospital, and we like to keep that mission alive too. There are 5 medical schools in Philadelphia, and 3 of them rotate through our hospital. So Temple University, Drexel University, and PCOM, which is Philadelphia Osteopathic Medical School. So a lot of different learners. We also have a dental residency that is a part of our hospital. So not just different learners, but learners from different backgrounds and different care areas that really help to collaborate with one another. Our residents take part in a lot of different initiatives. You can see, I'm not going to read through all of them because all of the programs have very similar initiatives and pathways, but a lot of the focus is for them to be really great clinician educators. And many of our residents have gone on nationally to be recognized for the work that they do. A lot have received awards and have gone on to be some of the really landmark people in their field. So we're really proud about all of the work that they've done and what they're able to bring back to our institution and make everyone else here proud. So I will stop there. Happy to take any questions, and thank you for your time.
All right. Thank you, Dr. Lewis. We appreciate you getting on and telling us about your program. So our next program is Children's Hospital of Philadelphia. If your program representative.
Before CHOP starts, can I just mention something real quick?
Yeah.
I just texted Stu Mackey from UConn to let him know that something might have gone wrong. So hopefully he will be getting back to me or you shortly.
Great, thank you. We'll loop back around to UConn at the end. So if he hops on, we'll give him an opportunity then. All right. So could the representative from CHOP unmute and tell us a little bit about your program?
Yeah, hi, welcome. My name is Janine Ronan. I'm the program director, and joining me is Dr. Adelaide Barnes, who's one of our associate program directors and chair of our intern selection committee, and one of my rising chief residents, Dr. Priya Brito. Adelaide loves this event so much that she is recovering after traveling back from Botswana. So she is a little bit jet lagged, but she'll definitely add some extra comments into the chat for us as well. So as I mentioned earlier, CHOP is one of a large residency program. We have 61 interns that make up from a variety of different programs. So we have categorical pediatrics, and in categorical pediatrics, we offer a global health track as well as a LEAP track, which stands for Leadership, Equity, Advocacy, and Policy. We also have a child neurology program, a peds genetics program, and med peds. So that combination makes up the 61 interns that we welcome in each year. And then, of course, the second and third years that continue to return. So I think one of the big advantages at CHOP is that we are kind of a one-stop shop. So we are both a community hospital to the West Philadelphia and South Philadelphia regions, but we also are a large regional referral center for really the tri-state area, as well as the rest of the country, and a lot of international patients. So you will care for patients that come from all different backgrounds. In one room, you might be caring for a patient from West Philadelphia that is a former premature infant here for bronchiolitis. And then you might walk into the room next door and have a patient that has traveled halfway across the world to be able to get some of the specialized care that we offer. We are definitely very proud of our roots as a large academic institution and really encourage a lot of the residents to get involved in research projects if it's something that you're passionate about. And research is very much all-encompassing. It can be basic science, clinical research. It can be more based in the QI or implementation science realm of things, health services research, medical education. It can really take any of that, those areas, depending again on what your passions are. And I guarantee if there's something you're interested in, I can find a faculty member that's going to be excited to work with you with that. One of the things that we're really proud of is we have something called a GRIP grant program, which are basically grants that residents and only residents can apply for. And so we're able to support a lot of residents with some of their beginning research projects through that, which is an internally funded program, which then allows residents to be able to travel to national meetings and present their work. We have been doing the X plus Y schedule for quite some time. This is our 5th year with X plus Y scheduling. We were part of some of the initial cohorts that experimented with it, and I'm a huge fan. I think it allows a lot of flexibility and allows you really to get the most out of each of your clinical rotations that you are working on. We are making some adjustments to X plus Y to be able to sort of meet the new ACGME requirements, but I think it's really just going to enhance the programs and allow for the residents to kind of get the most out of each of those experiences. We also have a lot of diversity initiatives, both to encourage people to come to come as medical students to experience CHOP as well. There's also similar programs for you to come as a resident if you're thinking about it for fellowship. We also have a really large community of folks that come from backgrounds underrepresented medicine, and we have a affinity group called MPA, or the Multicultural Physician Alliance, and they partner with a similar group over at Penn called the Alliance of Minority Physicians. So there's a really strong community that you're able to build. And we also have a lot of curricular initiatives, as well as a group called Pop at CHOP, which is for folks that identify as LGBTQ, as well as their allies. Additionally, I'm really proud of a lot of the well-being initiatives that we've been working on, in particular to support community activities. We have a lot of social events. We have a lot of very structured resilience curriculum where we talk about what it feels like to have imposter syndrome, or how you can build your career and how you can deal with some of the challenges related to residency, which we deal with like during our retreats as well. And we have a really structured communication skills training course through something called Vital Talk. There's a lot of longstanding CHOP traditions, starting from intern picnics, retreats. We have team dinners after you've been on service with some attendings that you get to go out to dinner with them and see them sort of outside the hospital. CHOP prom is a fun formal event that we do every year. And I think one of the other really big advantages of CHOP is just being in Philadelphia. Philadelphia is a really manageable city, lots of great food, lots of great sporting events, culture, all the things that you kind of look for. And the shore, as well as the mountains, is not that far away. And I'm done. 3 seconds left. Thanks.
Thank you so much, Dr. Ronan, for sharing about your program. Now, our next program of the evening is UPMC Children's Hospital of Pittsburgh. I would like to invite your representative to share about the program. Okay, unfortunately, we do not have any representative from UPMC. Attendees are free to look at the infographic later on our YouTube channel, but we do have a representative from UConn. Dr. Mackey, you are up. Go ahead and share about your program.
Thank you very much. And my apologies for being a little bit late. I was on call and lost track of time. So I'm Stu Mackey. I'm the Pediatric Residency Program Director at the University of Connecticut Pediatric Residency Program. We are ACGME certified for 66 residents totally, currently 62, building up to that full complement of residents in the next couple years. We really try to highlight as a program an individualized curriculum where we have 22 different pathways covering all different subspecialties, primary care, global health, research, advocacy, and medical education. I think one of the things our residents really enjoy is that they have a good amount of discretionary time in order to be able to do these different aspects of the curriculum that we've developed, with many residents going to do global health as well as other advocacy experiences within the community that we serve. We're located in Hartford, Connecticut, which is the capital city of Connecticut. And so there are a lot of really great advocacy work going on because we are in the state capital of Connecticut that residents are able to get involved in. The state capital is actually only about 2 miles away from the main hospital. Connecticut Children's is a freestanding children's hospital. It's the only one in the state of Connecticut, offering our residents the opportunity to work different subspecialties, multiple different fellowship programs. Most of our fellowship programs are a little bit on the smaller side, and so it's still very much residency driven as a hospital, and residents really get that opportunity to be the first line of care for all the patients they're caring for. We have a level 1 trauma center, an 18-bed PICU, a 78-bed NICU, and 83 general pediatric inpatient beds. We accept J1 visas as well for those that may be international medical graduates. Our curriculum, we switched this year to an X+Y schedule, which has really been working quite well for us as a program. There's always a little bit of new challenges with changes that come along, but it's really worked out very nicely in pulling out all the continuity clinic from our inpatient blocks. And so residents can really focus on the inpatient, and then during their Y blocks have a little bit more continuity clinic time as well as during their elective blocks in order to get those experiences. We also moved this year to an afternoon half day, an academic half day, as many people call it, to really be able to delve into doing more simulation-based curriculum, which we're developing this year and which should be fully implemented by next year. Residents have the ability to do simulation both while on acute care blocks and also during the academic half day, as I just mentioned. We have a lot of resident wellness activities that are going on, both that are driven by our resident wellness committee that really allow us to come up with things that residents are interested in doing. Residents all have a 1-day class retreat as well in the fall and spring of all 3 years, where they get together as a class, do fun activities, whether it be ropes courses, doing pottery, going to the beaches. We're not too far from them. A lot of different fun things that they've done for those. Residents get 3 flex days as well per year to use in addition to 4 weeks of vacation time. And one of the things that we've done too is the wellness initiative is all residents are actually scheduled with a mental health provider for the first couple months, knowing that starting residency is a big transition. There's a lot of new additional stressors. A lot of times people are away from their support structures. And so it's an opt-out program where if it's not something that you feel like you need to do, you can always opt out. But otherwise, as the appointment's made, we protect you to be able to go to that appointment as well as any medical appointments. We're very flexible with that in order for people to be able to take care of themselves during a busy 3 years during residency. And we've really been working to increasing time residents have to be at the bedside. We recently actually had a platform presentation this past academic year about ways of trying to streamline our electronic medical records, realizing that part of wellness too is being able to actually take care of patients and not doing all the documentation. We've had a lot of diversity initiatives as well as the program. We have a DEI committee that regularly holds events for residents, as well as we've had their DEI committee participate in various national conferences for recruitment. We are part of the larger UConn Health as well, and they have multiple different affinity residents that come from different backgrounds and different places, different affinity groups. And that's been a really nice way for residents to find a larger community that they may identify with, even beyond Connecticut Children's. We also have an annual DEI conference as part of our curriculum that's embedded into the academic half day. And we do sponsor a URIM 4th year rotation through VSUM. And if you're interested, please look at our UConn website. There's more information within that, the UConn GME website, as a way to get experiences there. And then just quickly talking as I finish up a little bit about the location that you're located in Hartford, Connecticut. We're in the state capital, as I mentioned, which gives a lot of great opportunities for advocacy. We're also very close to West Hartford, which is one of the areas a lot of our residents live in, that has a lot of great activities in the surrounding area, which include hiking, going to beaches. There's the coast of Connecticut or Rhode Island. And we're about an hour and a half to 2 hours away from Boston and about 2 hours away from New York. So a lot of our residents will go to those bigger cities when they want when they want to see family, friends, or other cultural events. But there's a lot going on within Hartford as well, including the Bushnell, which actually has a lot of off-Broadway productions that residents have really enjoyed. We also have the XL Center in Hartford as well, which brings in a lot of concerts that residents have enjoyed as well during their 3 years with us. So if you want to learn more about our website, please, about our program, please check out the website below or follow us on Instagram as well, which is below. So thanks very much for having me tonight. It's great to get to talk a little bit about our program, and there's a lot more information on our website as well.
Thank you, Dr. Mackey. We appreciate you sharing about your program. So that concludes the program overview portion of the evening. We have time for 1 or 2 questions, and it looks like y'all have been using the chat. So any program representative is welcome to unmute and answer the questions. I'll start with how will programs utilize geographic area preference?
I don't know whether people think of us as an urban program or a rural program, so I have no idea how to use that particular signal.
Yeah, I think in general, it's helpful to know people who are interested in our area, especially if your hometown might be, from the West Coast or the South, and it may not be clear what your ties are. So it's helpful when people are able to indicate that they might have family or just want to come to New York to try something new. All of that is certainly welcome and helpful information.
There is data on the AAMC website looking at program signaling and geographic preferences and your likelihood to get an interview. I refer you to that data. It's the most comprehensive data you can look at and see how programs overall look at those 2 pieces of your application.
All right, everyone. Thank you so much. Once again, if you didn't already get the chance, let us know what you thought about tonight's event by completing our survey. Feel free to scan the QR code on the screen or click the link in the chat below. As a reminder, there is a one-time registration for all of our webinars. Although I'm really thankful for everybody who was there for all of these webinars. Without you guys, this would not have been possible. We do have one webinar coming up in October. Feel free to scan the QR code on the screen. And thank you again for taking the time out of your hectic schedules to be here tonight to support us applicants. We appreciate you more than you know. We hope everyone has a great rest of your night.
And I just wanted to echo Sheena. Thank you guys seriously so much for being here. Program directors and representatives and participants alike. These would really not be possible without your engagement in the sessions. And we just thank you so much. And I just want to personally thank our entire FPR team. It has been incredible working with all of these individuals over the last couple months. And we've put on so many amazing webinars this summer. And without the help of all of these 25 individuals who are working from across the country, but also internationally, these really would not be possible. So I just want to give a huge shout out to our FPR team. We love you. We just cannot thank you guys enough. So huge shout out to them, and check us out in October if you're interested in coming back and hearing one more webinar about interviewing and the interview process. And if you've missed any, please check out our YouTube channel. You can find all of the recordings there. So thank you guys again so much. We will let you go with that. But have a great night, everybody.